The Centers for Disease Control issuing an alert to healthcare professionals who care for children. Cases of severe hepatitis in children popping up in several states. At least 3 children have needed liver transplants. And WPTV News Channel 5's Tanya Rogers reports on what local pediatricians are looking out for.
For the event on Saturday.
Courtney Sharp and her friend Tracy own a company that sells supplements and protein powder products. They try to make sure their family stays healthy, but Courtney says the latest medical alert of hepatitis in young kids is alarming.
Hepatitis is nothing to play around with, so the fact that it's just popping up in kids, really not understanding where it's coming from, is scary.
The CDC reports in some states have seen an increase in pediatric hepatitis without a known cause. More than a dozen cases, 2 kids needing liver transplants. No cases reported in Florida.
Hepatitis is a blanket term that's used to describe diseases that cause inflammation of the liver.
Dr. Young Singh De Silva says the CDC says it's a new type of hepatitis which is affecting children, especially under the age of 10.
In these series of cases of this new hepatitis, a lot of the patients have been testing positive for a particular subtype of an adenovirus. Too severe stomach bug, essentially, which presents with nausea, vomiting, diarrhea, and fever.
Kids can also be jaundiced.
You see yellowing of the eyes and perhaps a yellowish tint to the skin.
Dr. De Silva says it's important to remind the kids to practice good hygiene.
Adenovirus is transmitted primarily through surfaces and from a fecal-oral communication and transmission, so I think hand washing is very important.
But if you notice something unusual, contact your pediatrician.
Anytime you see something like that, it's very scary. For me, I take health serious.
Tanya Rogers, WPTV News Channel 5.